For women who really like the habit of taking a daily pill but can't take estrogen, there is a progesterone-only pill available. And theoretically, that works just as well as the combined pill. A single pill is taken every day, and there's no placebo week. The menstrual cycle is not regulated as well because there isn't any estrogen, so people can have unpredictable bleeding or mid-cycle spotting. With the combined pill that contains estrogen, I usually say it's pretty forgiving. If you realize you forgot your pill, you can take it as soon as you remember. If you go to take your pill and you see yesterday's sitting there, you can take 2 at once, double up. If you miss 2 days, we recommend taking 2 today and 2 tomorrow rather than 3 at once because the estrogen can cause you to vomit. But you still would trust the pill unless you missed 3 days of active pills. With the progesterone-only pill, I advise women to try to take it at the same time every day within about 4 hours. This is because studies of hormonal levels have shown a peak within an hour or 2 of taking the pill, and that most of the progesterone effect is gone in 24 hours. In actual practice, it's not clear that this correlates with higher unintended pregnancy rates, but I do recommend that if someone realizes she missed her pill 12 hours ago with the progesterone-only method, that she use condoms as backup for about a week. This can be a lot harder for women who are breastfeeding or taking care of a newborn because it's just really difficult to remember to do something at the same time every single day. So while this is a great method for breastfeeding women in terms of safety, it might not be the best in terms of practical use. Emergency contraception could fit in many different places within this list of contraceptive devices, but I put it here. The original oral emergency contraceptive method involved combined hormonal contraceptive pills. We had a table of different available pills, and we could tell the patient who had pills already prescribed to her, take this many of your pill today, and then this many 12 hours later after a condom failure or another time when she was at risk of pregnancy. The problem with that is that the estrogen doses could be really high to get enough progesterone to disrupt ovulation, so that would lead to side effects like vomiting. So in the 90s or aughts, they figured out that it could be emergency contraception was effective with progesterone only. So Plan B was released then, which is levonorgestrel in 0.75 milligram tablets. This is the original Plan B in this package that contained 2 separate tablets, one to be taken immediately and another to be taken 12 hours later. This is effective up to 5 days after unprotected intercourse, but it is most effective the sooner you take it. So as soon as the condom breaks, you get the Plan B and take it, will be more effective than if you get around to taking it 5 days later. Subsequently, studies have demonstrated that you don't have to do this 12-hour separation because we're not worried about the estrogen causing vomiting with a really high dose. You can take both pills of the Plan B at one time. And it's now available as what's called Plan B one-step, which is a single 1.5 milligram levonorgestrel pill. So that's really easy. You say, the condom broke, go to the pharmacy, buy Plan B one-step, and just take it right away. And that can be really effective at preventing ovulation. We think that more of the effect is from preventing ovulation and not as much from preventing implantation. We know that this will not disrupt an established pregnancy. But using the medical definition of pregnancy starting at the time of implantation, we can say with confidence that emergency contraception does not cause an abortion. There is a second medication available for emergency contraception, which is ulipristal, which is marketed under the brand name Ella. This is also a single pill taken one time. Ella is just as effective 5 days after unprotected intercourse as it is the day of unprotected intercourse. Another benefit of Ella over Plan B is that Plan B seems to maybe be less effective in women with a BMI over 25, so that's a lot of women. The Ella is less effective with a BMI over 30. Ella is only available as a prescription, and insurance doesn't always cover it because Plan B is over the counter. But both medications are effective and available. They're really good to remember and to offer to people who are using non-hormonal methods, just to make sure they have them on hand in case their contraception is not available to them. Another excellent and even more effective option for emergency contraception is placement of a copper IUD. This is over 99% effective at preventing pregnancy. The downside is it has to be placed by a provider in the office, and not everybody wants that procedure. But for someone who is interested in an ongoing long-acting method and is a candidate for emergency contraception, the copper IUD is a really great option. The injectable contraceptive is marketed as Depo-Provera. This contains medroxyprogesterone acetate, so you can see it abbreviated as DMPA for depo-medroxyprogesterone acetate. It is available as a 150 milligram dose to be given intramuscularly or a 104 milligram dose to be given subcutaneously. Typically, it's given in a provider's office, but in this time of avoiding healthcare settings, I have done prescriptions for people to pick up at the pharmacy and either administer themselves or through a nurse that's closer to their home. The injection comes as a syringe. It's a cloudy fluid, and it comes with a needle. This is best given in the upper outer quadrant of the buttock because it's a large volume injection. The first time someone when someone starts the Depo-Provera contraceptive method, we need to do an assessment for pregnancy. Once somebody has had a negative pregnancy test and started the method with a provider visit, we then have protocols in the office, so only a nurse visit is required, and the nurse can administer it without consulting with a physician or a nurse practitioner at all, as long as the patient presents less than 14 weeks after her last dose. One downside of Depo is that it can contribute to weight gain, which can be really problematic for some women. It also is incredibly effective, and it's so effective that when someone stops taking it, it can take up to a year to become pregnant. So if someone thinks she might want to be pregnant within the next year or two, I usually don't recommend Depo as a method because it can take so long for fertility to return. Several contraceptive implants have been available in the United States. The first that I can recall, it was called Norplant, which was, I think, 6 different little rods that were inserted under the skin. And then when they were removed, you had to find all 6. And it sounds like that could be really difficult to do. This was removed from the market for a while, and then Implanon was released. This has now been adjusted a little bit in the United States, so we now use Nexplanon, which is exactly the same as Implanon with just a simpler one-handed insertion device and the addition of barium so that it can be seen on X-ray. The Nexplanon is a small, flexible rod. The real one is white, not green, and it's inserted under the skin by a provider in the office. You can't see it under the skin at all when looking at the arm, but the patient can feel it. Trust me, I can feel this. I'm not sure you can see it on the camera, but it's right under there. It is labeled for use for 3 years, but extended use has been confirmed of efficacy up to 5 years. Unfortunately, that study didn't include very many women with a weight over 70 kilograms, so I'm a little bit more cautious in heavier women about using it for the extended duration, but it probably is just as effective. The Nexplanon is incredibly effective. The original studies of Implanon had no unexpected pregnancies. It's actually more effective than either intrauterine device. Intrauterine devices are also placed in the office by a provider. There are several different hormonal devices that are available. The Mirena contains 52 milligrams of levonorgestrel and is labeled for use for 5 years, but extended use has been demonstrated of efficacy up to 7 years. The maker released Skyla as an alternative that they marketed to adolescents and women who had never had a baby. It is a smaller device. The purple one is the Skyla. So it's a slightly smaller device, and the insertion device is actually a little bit smaller too, so it's meant to be a little easier to put in. It doesn't have as much hormone, so it is not effective for as long, and the Skyla should be removed after 3 years. Extended use is not recommended for the Skyla. Liletta has the same amount of hormone as the Mirena, which is 52 milligrams, and should also be effective for 7 years, though it was not specifically studied for extended use. It is a less expensive device released by a different manufacturer, designed to reduce the device cost. Another option is Kyleena, which has a greater amount of progesterone than the Skyla, but in a small device like the Skyla. So it works for 5 years, but is a little bit smaller than the Mirena. All of these devices work by just the presence of a foreign body in the uterus creating a different effect inside the endometrial cavity that makes it difficult for sperm to survive the trip up to the fallopian tubes. The hormonal methods also seem to cause some atrophy of the endometrial lining, which is why the period becomes lighter with all of the progesterone devices. With Skyla, the periods become fairly unpredictable for a lot of women, though some would have no periods at all. With Mirena, menstrual suppression is pretty consistent, and we actually can use it specifically for the indication of suppressing heavy menstrual periods. Generally, the hormonal IUDs are really well tolerated. Some people find that they gain a little bit of weight or have trouble losing weight. Some people have other hormonal effects like headaches. Some people generally just don't feel well with hormones. So those all might be reasons that somebody might choose to have an IUD removed. The copper intrauterine device again works as a foreign body in the uterus, creating an unfavorable environment for sperm. The copper itself creates there are more enzymes and more macrophages around, so it just makes it really hard for sperm to get through. The copper device is about the same size as the Mirena, and you can see the coil of copper around the body of the IUD. This is labeled for use for 10 years, but extended use has been demonstrated to 12 years. It's very effective. The most common reason that people want their copper IUD removed is very heavy and crampy periods. They're especially crampy compared to suppressed periods that someone might have had on the contraceptive pill. But many people are happy to tolerate the heavier periods to have a very effective method without any hormones at all.